so we're going to be doing the IV antibiotic administration skills video. Our patient is Mrs. Nagel, who's presenting to the ED with signs and symptoms of a postoperative infection. So she has an order for Zosyn, 3.375 grams and 100 mLs to be infused over 4 hours. So I'm checking my med order. I'm going to confirm this patient doesn't have any allergies to Zosyn, also any allergies to penicillins, because this med may be contraindicated in patients with allergies to penicillin. So I know Zosyn is a broad spectrum antibiotic, so it makes sense that they would be using that in the emergency department. Since they don't have a culture yet, it can treat a lot of different types of infection. Since she is in the ED, we're going to assume we're running this through a peripheral IV line as opposed to a central line that would have a hep block, so she has no continuous infusions. If we were working with a heparin lock, I would pull back and waste the heparin lock and not flush it into the patient, but we'll be using a peripheral line. So it says to infuse over 4 hours, drop factor of 10 drips per ml. If we needed to calculate a drop rate, it would be 4 drips per minute, but in this scenario, I'm going to use an IV pump in the room. So for 100 mLs to run over 4 hours, will be 25 mLs an hour. Okay, so I've checked the medication order and the patient's allergies. I know why she's getting the medication. I'm going to wash my hands, and I'm going to go gather supplies. I'm going to go to the supply room and get my tubing, flush, alcohol pads. I'm going to get my med cart, bring it outside my patient's room, going to access the med cart, and I'm going to pull the medication and confirm this is the right medication with the MAR order. Going to check the back for expiration dates. So I've confirmed the label against the MAR that this is the correct medication. So we're going to take a computer cart into the patient's room. Hi, Mrs. Nagel. My name's Marina. I'm going to be the nurse taking care of you this evening. I'm going to go ahead and wash my hands. I'm going to take a look at your armband. Can you please tell me your name and date of birth? So I'm going to compare her name and date of birth with the patient's record that I have open and the MAR. This is the correct patient. So Mrs. Nagel, you have some complaints where they're concerned you have some signs and symptoms of an infection after your surgery. So we're going to administer Zosyn, which is an antibiotic that can treat a lot of different types of bacteria, so we can get you feeling better. Okay. Do you have any allergies to any medications? Okay, so she has no allergies to Zosyn or penicillins or anything else that would be concerning. So I'm going to scan the patient's armband and scan my medication. Do another check with the MAR, right patient, right med. This is the right time that this med needs to be given. So I'm going to assess her peripheral IV site, and it looks good. There's no signs of infiltration. Okay. So we're going to set up our medication on the pump. Oh, I put gloves on after I washed my hands, by the way. So I'm doing this with clean gloves. Going to clamp the tubing. We're going to be sure not to contaminate either end of this after opening. And we're going to spike our medication bag. Going to fill the drip chamber up partially to the line. And we are going to prime this tubing. My and slow so you don't get any bubbles. Okay. I'm also going to label this tubing with the date and time that we have hung it. Okay, so I'm going to remove the disinfected cap, but I'm also going to scrub her hub with alcohol. Gonna get any bubbles out of our flush. We're gonna flush her line. And maintaining sterility of this cap, we're going to connect it to our IV site. So I'm going to program the pump with the medication. We have our Zosyn, 3.375 grams. It's in 100 mLs and it needs to infuse over 4 hours. So we're going to program the pump for 25 mLs per hour. And I'm going to document in the MAR that we have hung it. We already scanned it. I'm also going to document this in her eyes and nose. I'm going to monitor the patient for any signs, symptoms of an adverse reaction, and also periodically monitor their IV site for any signs of infiltration. And I'm going to take my gloves off, wash my hands. All right, Mrs. Nagel, I'll check on you in a little bit.